I want to specially welcome you to another episode of Antenatal Online Podcast, and with me is Dr. K's.
Thank you.
You are welcome, Doctor. And today we shall be discussing the common, yet preventable cancer in women. Cervical cancer. Cervical cancer is the third most common cancer and fourth leading cause of cancer death in women worldwide. It is one of the few cancers that is almost 100% preventable and treatable if detected early. According to a study done by David K Gaffney et al. In 2018, one woman dies from cervical cancer every 2 minutes, adding to over 270,000 deaths globally per year. Without further ado, what is cervical cancer?
Cervical cancer is a type of cancer that starts from the cervix. In classification, there is cervical intraepithelial neoplasia and invasive carcinoma. The cervical intraepithelial neoplasia is a disordered growth of cervical epithelium. It is the pre-cancer form of cervical cancer, and it is commonly detected in women in their 20s.
Interesting.
According to histological equivalent, it is classified as mild, moderate and severe dysplasia. There are also the British Society for Cervical Cytology and Bethesda System classification. Don't let me bore you with too much.
Wow.
Yes, there's also the microinvasive carcinoma. This is when the precancerous cells penetrate the basement membrane of the cervix, but does not affect the lymph nodes. For the invasive carcinoma, there's the FIGO staging system. Also, there is the histological types of cervical cancer: squamous cell carcinoma, adenocarcinoma, adenosquamous carcinoma. The most common of the three is the squamous cell carcinoma.
What are the causes of cervical cancer?
Most cervical cancer cases are caused by human papillomavirus. This is the same virus that causes genital warts. The primary cause of this cancer is infection with the human papillomavirus, commonly known as HPV. There are about 100 variants of HPV and 8 variants causing cervical cancer: type 16, 18, 31, 33 and 4 other variants.
Interesting. So what are the red flags that if seen, the woman must schedule an appointment with the doctor?
In the early stages of cervical cancer, which is the cervical intraepithelial neoplasia, it does not show you any sign or symptoms, and this is why it is mostly missed until the cancer advances. Patient present with vaginal bleeding after sex, after menses or during menopause. 2 watery, bloody vaginal discharge that may be heavy or foul-smelling. 3 pelvic pain or pain during sex. 4 weight loss. 5 anemia. 6 body weakness.
And at what age does it occur in women?
It occurs between the 5th and 6th decades with the average age at 51 years.
Thank you, Doctor. Can you share more light on the risk factors?
Sure, the risk factors include 1. Multiple male sexual partner and male sexual partner with multiple sexual partner. 2. Early sexual activity. Having sex earlier in life, before 17 years. 3. Early age at first birth. 4. History of sexually transmitted disease like HIV, syphilis, gonorrhea, etc. 5. Smoking either cigarettes, shizzler. 6. Weak immunity. 7. Obesity. 8. Family history of cervical cancer. 9. Long-term use of combined oral contraceptives pills. 10. Poverty.
This is so interesting, Doc. And what are the necessary screening and investigations to diagnose cervical cancer and treatment?
The screening includes 1. Pap Nicolau smear, commonly known as Pap smear. It is a method of cervical screening used to detect potentially precancerous and cancerous processes in the cervix or colon. It involves collecting cells from your cervix. 2. Colposcopy. And 3. Schiller test. Some of the investigations your doctor would request include 1. Full blood count. 2. A kidney function test, that is electrolyte, urea and creatinine. 3. Chest X-ray. 4. Examine the cervix under anesthesia. 5. Punch biopsy, a pinch of the cervical tissue is taken. 6. Endocervical curettage. 7. Cone biopsy. 8. Computer tomography, Connecticut and magnetic resonance imaging (MRI) in the management of cervical intraepithelial neoplasia in pregnancy. Treatment is delayed till after delivery while in invasive cervical cancer. If the age of pregnancy has advanced, early delivery is recommended, but if the pregnancy is early, abortion is suggested. The treatment of cervical cancer includes 1. Surgery. The early stages of cervical cancer is treated by surgery. 2. Chemotherapy is the use of certain drugs to kill the cancer cells. 3. Radiation therapy. This uses high-powered energy beams such as X-ray or protons to kill the cancer cells. 4. Immunotherapy, targeted therapy and supportive care.
What are the chances of survival?
Survival rate. That is the prognosis. The chances of living for at least 5 years after being diagnosed of cervical cancer for early stage is 80 to 99% and less than 56% in late stages.
Wow. So how do we prevent this deadly disease?
The recommended preventive measures include 1. Reproductive health education starting from the home. 2. Vaccination with the human papillomavirus vaccine. 3. Regular screening of sexually active women and women in their reproductive age. Routine screening of pap smear, every 3 years. Every lady in the age bracket of 21 to 29 years should get a pap smear done once every 3 years. While ages 30 to 65 years should get a pap smear, plus high-risk HPV test every 3 years. Other preventive measures include protective sex and sticking to one sexual partner. Note that condoms are not as protective against HPV as it is against other cysts due to labioscrotal contact. Avoid every form of smoking, and lastly avoid early sexual exposure.
Wow, and that brings us to the end of today's discussion. We must continue to sensitize our community about cervical cancer and the benefit in early prophylaxis. I celebrate Antenatal Online, Smile With Me, Project Pink Blue, WHO, Gavi and others for the great public awareness about cervical cancer. We encourage more organizations to join in creating more awareness. Cervical cancer is deadly, but vaccination and early detection is life-saving. Thank you, Dr. K, for such an amazing insight into cervical cancer.
My pleasure, Lizzie. Thank you for having me on the show.